The Great Plague of Marseille in 1720 was a devastating outbreak of bubonic and pneumonic plague in the French port city of Marseille. It was one of the last major epidemics of bubonic plague in Europe. The outbreak led to significant loss of life and posed a grave threat to the region's trade and commerce. Efforts to control the plague included quarantine measures and the burning of contaminated areas. The yellow fever pandemic refers to several outbreaks of the viral disease yellow fever that have occurred in various parts of the world. It is transmitted through the bite of infected mosquitoes and can lead to severe illness, with symptoms including fever and jaundice. Historically, it played a significant role in the colonization of the Americas and Africa. The swine flu, also known as the 2009 H1N1 influenza pandemic, which emerged in 2009, was characterized by a novel strain of the flu virus with genetic components from both swine and human influenza viruses. In addition, the sequence indicates that the genetic makeup of the virus had been circulating in pigs in central western Mexico for more than a decade. The typhus epidemics refer to various outbreaks of typhus, a bacterial disease caused by Rickettsia bacteria, throughout history. Typhus can be transmitted through body lice and fleas, often spreading in crowded and unsanitary conditions. People can become infected with typhi when they come into contact with infected flea droppings through broken or abraded skin. These epidemics have had devastating effects on populations, causing high fever, severe weakness, and, if left untreated, often leading to death. Notable typhus epidemics occurred during wars and in times of social upheaval when sanitation and hygiene conditions deteriorated. The sixth cholera pandemic was a global outbreak of cholera that occurred in the late 19th and early 20th centuries, caused by the bacterium Vibrio cholera, is transmitted through contaminated water and food. This pandemic primarily affected Asia, particularly India, and subsequently spread to other parts of the world. The Russian flu was caused by an H3N8 influenza virus and is one of the earlier documented influenza pandemics. The term Russian flu was used because initial reports came from Russia, though the origins are uncertain. The 1889 pandemic spread quickly through modern transportation. Railroads travel by sea from current travel time by air, and steamships connected the world, allowing the virus to travel quickly and easily. This pandemic affected populations worldwide, leading to significant illness and fatalities. While milder than some later influenza pandemics. The third cholera pandemic is a waterborne bacterial disease caused by Vibrio cholerae. It spread to Europe, Africa, and North America, resulting in significant mortality. This pandemic was instrumental in advancing our understanding of the disease's transmission, ultimately helping to control its future outbreaks. The Asian flu, also known as the 1957 influenza pandemic, studies have shown that this virus is a reassortant strain, a mixture of two or more strains, that originated from a mutation in wild ducks merging with a human. Influenza viruses. This pandemic resulted in significant illness and death worldwide. It was notable for its rapid spread and was the first influenza pandemic in the era of modern virology. The Hong Kong flu, also known as the 1968 influenza pandemic, was a global outbreak of the H3N2 influenza A virus. Originating in Hong Kong, it rapidly spread around the countries as far as India and the Northern Territory of Australia, as happened in the 1957 epidemic. In all countries other than the United States, the disease was not severe and did not result in a significant increase in deaths. This pandemic was less severe than some previous influenza outbreaks, but it still caused substantial illness and death, particularly among the elderly. The COVID-19 pandemic, ongoing as of my last knowledge updated October 22, 2023, is a global health crisis caused by the novel coronavirus, SARS-CoV-2. It emerged in late 2019 in Wuhan, China, and quickly spread worldwide. This pandemic has led to millions of infections and deaths, as well as widespread social, economic, and healthcare disruptions. Efforts to control the virus have included widespread testing, vaccination campaigns, and public health measures like mask wearing and social distancing. The Antonine Plague was a severe pandemic in the Roman Empire. This infectious disease, likely either smallpox or measles, significantly impacted the population. It's named after the Roman Emperor Marcus Aurelius Antoninus, who reigned during the outbreak. The Antonine Plague led to a substantial loss of life and economic disruption, and had implications for the Roman military and society. Its exact cause remains a subject of historical debate, but it undoubtedly left a lasting mark on ancient history. The Deadliest epidemics was a mystery disease outbreak that was exacerbated by anomalous weather and featured high fevers and bleeding. The illness was caused by an indigenous viral agent. The Deadliest epidemics underscore the profound impact of introduced diseases on Native American populations during the European colonization of the Americas. The Spanish flu, a devastating influenza pandemic, was a global disaster caused by the H1N1 influenza A virus. A case of the disease was first documented in Kansas in March 1918. In April, France, Germany, and the United Kingdom reported further cases. It is considered one of the deadliest pandemics in history, infecting a third of the world's population and resulting in millions of deaths. It had a disproportionate impact on young, healthy adults, unlike typical flu strains. During World War I, wartime censors suppressed bad news to maintain morale, while newspaper coverage of the outbreak in neutral Spain was free. The HIV/AIDS pandemic is a global health crisis that emerged in the late 20th century. Human immunodeficiency virus, HIV, weakens the immune system, making individuals vulnerable to various infections and cancers. Acquired immunodeficiency syndrome, AIDS, is the advanced stage of HIV infection. The pandemic has claimed millions of lives worldwide, with significant social and medical efforts to prevent and treat the disease. It has led to increased awareness about safe practices and sparked advances in antiretroviral therapy and HIV prevention methods. The Justinian Plague, which occurred between 541 and 542 AD, was a devastating pandemic during the reign of the Byzantine Emperor Justinian I. This pandemic was caused by the bacterium Yersinia pestis, responsible for bubonic and pneumonic plagues. The outbreak swept through the Eastern Roman Empire. In 541, the epidemic reached Roman Egypt, spread to the Mediterranean Sea until 544, and spread from there to northern Europe and the Arabian Peninsula until 549. It's often considered one of the first recorded instances of the bubonic plague. It is thought to have had far-reaching consequences on the course of history in the Eastern Mediterranean. The Black Death, also known as the bubonic plague, was a devastating pandemic in the 14th century. It was caused by the Yersinia pestis bacterium, transmitted through fleas on rats. This deadly disease swept through Europe, Asia, and Africa, causing the deaths of tens of millions of people around the world. Symptoms included swollen lymph nodes, high fevers, and blackened skin, giving it the name Black Death. The pandemic had far-reaching social, economic, and cultural impacts, reshaping the course of history. The smallpox epidemics refer to the historical occurrences of smallpox, a highly contagious and deadly viral disease caused by the variola virus. There is no evidence that insects or animals can spread smallpox. It can only be transmitted by humans. Smallpox is characterized by fever and the development of painful skin lesions. Smallpox has ravaged human populations for centuries. Efforts to combat smallpox included the development of the smallpox vaccine by Edward Jenner in the late 18th century. The successful eradication of smallpox through vaccination programs in the 20th century is considered a major triumph in the history of public health.